a lot of the focus on kids in COVID-19 has been on the impacts on kids. How many are hospitalized, how many die, how many have serious complications, and what we know is that kids, aren't as impacted as other populations or older age groups, with regard to those serious complications from COVID-19. But I think what people so often overlook is that kids can be, carriers of the infection. They're the ones who can bring it home to mom and dad, to grandmas and grandpas. And oftentimes they can infect them without even knowing that they're infected and sick. And so I think that's the hard part here, is that they're, kind of vectors. They, can spread the infection to other people. And so if there's someone who's at high risk for complications, like we talked about before, if they have underlying health conditions, cancer, lung disease, heart disease, pregnant, and they're not vaccinated, the best recommendation that we can give is to, think about wearing a mask, in your home. It's challenging to socially distance within the household, but that's why a mask, is recommended. I know it's kind of oftentimes odd for people to think about wearing a mask in their own household, but really, if you're concerned about your health and you have these underlying conditions and you're not vaccinated, and your kids are out in school and coming home, and we're seeing right now a lot of cases in our schools, that's probably a good thing to think about is masking. If people don't want a mask, then I think overall, in general, it's just keeping care of yourself, exercising, eating well, getting good rest, those things that can help boost your immune system, because without a vaccine or without a mask, really your immune system is what's you're left with. And so it's best you can keep that healthy. It's going to be your best defense against the potential for getting infected from those kids who are coming back home from school.